Hello friend, welcome to my channel 5-minute pediatric. Today we will discuss about what are the changes made in NRP 8th edition. So better we will compare NRP 7th edition to the NRP 8th edition so that we can easily remember what are the changes made. So when we look after the NRP 7th edition, the four prerequisite questions were: the first one, what was the gestational age? Second one was, is the amniotic fluid clear or not? Third question, how many babies? And fourth question was, additional risk factor was present or not. Now in NRP 8th edition, the four prerequisite questions remains the same. So here also we have gestational age. Second question was amniotic fluid clear or not. Third question was additional risk factor or not. Fourth question, which was replaced by umbilical cord management. In 7th edition, how many babies was there? Here one replacement has been made, umbilical cord management plan. Okay, so you can remember it. Next next change we have in NRP 7th edition? Initial steps were warm and maintain body temperature, position airway, clear secretion if required, dry then stimulate. These are the initial step of management. In NRP 8th edition, we have initial step as warm, dry, stimulate, position airway, suction if needed. Okay, only initial step remains the same, but there is only some corrective measures have been repositions. Okay, so not so much change in initial step. Now in NRP 7th edition, an electrocardiac monitor is preferred method for assessing heart rate during cardiac compression. While when we see in NRP 8 edition, when an alternative airway becomes necessary, a cardiac monitor is recommended for the most accurate assessment of baby's heart rate. So here monitoring is advised earlier. Now in NRP 7th edition, flush IV epinephrine with 0.5 ml to 1 ml normal saline, while in NRP 8th edition the volume is increased. So now we have to flush with 3 ml normal saline and it is applicable to all weight and gestational age. So this change you have to remember. Now next changes what in NRP 8th edition we have epinephrine IV or intraosseous and endotracheal doses have been simplified for educational efficiency. For intravenous or intraosseous dose, we have 0.02 mg per kg to 0 or 0.2 ml per kg. For endotracheal dose, 0.1 mg per kg or 1 ml per kg. Now the time for resuscitation have been increased in NRP 8 editions. In previous, after cesations of heart rate, resuscitation was done for 10 minutes only. Now the resuscitative efforts have been increased up to 20 minutes. But it should be depend upon condition and it may be prolonged, resuscitation may be prolonged. In 8th edition, we have initial oxygen concentration depending upon gestational age. For more than equal to 35 weeks, we require 21% oxygen, and less than 35 weeks of gestational age, we require 21 to 30% of oxygen. Hope you like.